G'day, I'm Martin Laverty at Catholic Health Australia. The Federal Parliament at the moment is considering whether or not to put an end to the Australian Charities and Not-for-Profits Commission. When the ACNC was first proposed, Catholic Health Australia said to the then government that we didn't think it was going to add any value to consumer protections for those who use hospitals and aged care services run by church or charitable agencies. If you think about it, a hospital has to be licensed before it can start operation. It has to meet accreditation. It is overseen by a healthcare complaints process, and in more recent times its performance data is published on a My Hospital's website. If you think about an aged care service, it similarly too has to be approved by the federal government before it can deliver services. It has to meet accreditation. It is subject to sanctions in the event of something going wrong. And also, we will see from the beginning of this year that aged care services have to publish some of their data on the My Aged Care website. We've said to the previous and the current government that hospitals and aged care services run by charitable organisations are already sufficiently regulated such that public trust and confidence is not enhanced by having an ACNC in place. There's also some other concerns that we've expressed to the federal government about the ACNC. It's resulted in double reporting. Many charitable bodies have to report to their state government and the ACNC, a double up on what was once required. We haven't seen a reduction in red tape, and we're not seeing the federal government use the information that's provided to the ACNC for other purposes. Whilst the ACNC might have been a good idea, we don't think it's fit for purpose when it comes to hospitals and aged care services run by church and charitable organisations, because there is already sufficient regulation to ensure the safety and confidence that Australians need to have in their charitable, hospital and aged care services.